Swadikap. Hi, I'm Dr. Job and I'm a board certified plastic surgeon here at One Surgery and Aesthetics. So here we have an example of a skull of the patient. So as you can see here, if we remove the implant here, you're going to see that the skull of the patient has different texture from person to person, and there's a lot of variation in these underlying bony framework of the patient. So here we use a 3D digital imaging to let the patient see after the surgery what they are going to look like. And so here we can align the expectation of the patient before and after the operation. And also we use the CT scan or the CAT scan together with the image from the 3D digital printing to make a custom-made silicone implant. Here as you can see, so these custom-made silicone implant will have a perfect fit to the patient underlying bony structure and soft tissue. So I'm going to walk you through all the silicone implant that we have with an example. So first is the nose. In the past, we do a rhinoplasty without the 3D custom-made silicone implant. But here you can see that the bone here and the cartilage of the patient are so much different from one to another. And in the past, this silicone is not a perfect fit. So you can see complications such as the capsule contracture, and sometimes the silicone can move, and sometimes there is an extrusion of the silicone. But here you can see that if the silicone has been made perfect to the patient, it will be perfect fit such that there is no gap between the silicone and the bone, and hence these complications are much less. And also, since we can imagine image and what the patient are going to look like with the use of the 3D digital imaging, the expectation of the patient will be aligned with the operation that we do, and we expect that the satisfaction of the patient will be much higher. So in the past, without these technology, designing the silicone here around the upper part of the nose near the part of your eye is really usually difficult because the bone here is much different than the bone underneath. So, but with this 3D technology and the custom-made silicone implant, it will help in the sense that it can design the silicone that is very fitting to the curve around your glabella here. And the silicone will be tight, and it will also be a smooth curve between the nose and the forehead, and hence the silicone will not move, and it will be very perfect shape with the curve in the radix, and the patient should be very satisfied with this implant.